What industry is a lot more dark and sinister than most people realize? Fucking nursing homes. I didn't think the worst part of EMS would be learning how most nursing homes in my area treat their patients. But it is, by far.
I work as a therapist on the rehab side of a nursing home, otherwise called a skilled nursing facility. My goal is to try to help patients placed in our facility for a skilled level of care, meaning they are there for an acute medical event or hospitalization, recover from their illness/injury and hopefully return to their prior level of function. Sadly, it is becoming less and less common for me to see patients who make it out in better condition than they came in. Due to a multitude of reasons, it is now much more likely my patients will decline, die, or otherwise get stuck as a long-term care resident at our facility. This is despite my best efforts to help them get out of the situation. I've been in this field for 8 years. I have seen the quality of medical care in nursing facilities decline from bad to continually pushing the limits of my personal comprehension of negligent. Despite the best efforts of physical therapists, occupational therapists, and speech therapists that work in this setting, when the nurses and CNAs are the ones providing the majority of the care for the patients, there is only so much we can do. I'm just going to brain dump a few of the things I've seen and experienced in nursing homes. Sometimes it's absolutely like a scene from The Walking Dead. Gaping sacral wounds so large you could fit your fist into them. I have found patients who are completely dependent, lying in their own feces and urine for obviously hours on end. It is obvious if it's more than just one episode of incontinence that has occurred. Being ignored by nurses and nurse practitioners when I point out a patient is actively having a stroke. More deaths than I can count from refusal of nurses/doctors to send patients out to the ER in timely manner, or even call EMS to assess them. Gotta try to keep that census number up. Crash carts not being restocked with equipment to handle a coding patient after previous use, resulting in death for the next patient who needs it. I can't go on listing stuff, but you get the point. I step in to help remedy problems when I see them, but some things are outside of my scope of practice and I can't do much more than inform, educate, and advocate. I've had to do a lot of personal therapy to navigate the toll seeing things like this has taken on my mental health. I've stuck around in the field because I genuinely care for my patients. There are so many patients whose family will drop them off and never come back. I'm hanging on because I care so much for these people, and I want to believe it can get better. There will be a time when my mind/body can no longer keep going in this field and I will have to move on to a non-clinical role. I feel sorry for those who I'll be leaving behind.
The tomato industry. I went to a lecture for extra credit in college on the history of the tomato. I was expecting to hear how people used it and where people started growing them and whatnot. What I got was essentially a full season of The Sopranos. Extortion, murder, blackmail, vandalism, you name it. The tomato industry was rife with the worst shit.
I thought working at a local flower shop would be rosy and idyllic until I was told to upsell grieving widows on already overpriced casket sprays.
This is far too true. My wife is a floral designer at a large florist. She went in thinking ye play with flowers and make pretty stuff all day, and it is definitely not that most of the time. Sorry for your loss, that'll be $1,600.
That sounds like my veterinary work. It's incredibly difficult and sad having to read someone a $5,000 hospital bill for their dog that ended up not making it.
Good florists don't do this. I grew up in a flower shop and yes, upsell weddings, any celebration. But when it came to funerals it was, what is your price point? Here's what we can do within the price point. The real shit part is the online sellers, 1,800 Flowers and Telefloral. They take 30 to 40% of profits. So you order $50 flower arrangements, but the florist can only sell you $35 worth of flowers or they'll lose money.